In other news, the South African Health Products Regulatory Authority has confirmed the death of a person in this country after receiving the Hohnson and Johnson COVID-19 vaccine. Now, the individual, who we don't have much information on, we're told also suffered from GBS. Let's speak to Professor Charles Wiysonge about this. He's director at Cochrane, South Africa. He's with the South African Medical Research Council. Prof, a very good afternoon to you. Thank you so much for your time. So, this is the first, I think, confirmed death linked to a COVID-19 vaccine in some way in South Africa. Significant, of course, because a family has lost a loved one. But how alarmed should we be?
Thank you for having me. And it's a pity that this individual died. And, of course, we send our condolences to the family. But we shouldn't be alarmed. Billions of doses of vaccines have been given around the world, including the Johnson and Johnson vaccine. In South Africa, 37 million vaccines have been administered, including close to 10 million Johnson vaccine. But then this is what we should be assured that if anything goes wrong, we will be able to pick it and appropriate actions should be taken. So we shouldn't be alarmed.
And this person, we're not saying who it is because we don't know. The Health Products Regulatory Authority has said it cannot disclose that, but it's shared so far in its statement that this person suffered with GBS, which is a rare disorder where the body's immune system damages the nervous system. How much of a complication is that for the vaccine program in terms of deciding who should and should not be vaccinated?
I think everybody should still be vaccinated. Talking about Guillain-Barré syndrome, this is a very rare disorder in which the body's defense system, the immune system, attacks the nerves. And it usually starts by weaknesses and tingling in the hands and feet. And these are usually the first symptoms. And in very rare cases, these symptoms can spread and eventually paralyzing the whole body, which is what may have happened in this particular case. Guillain-Barré syndrome could occur after a bacterial infection, after a viral infection, and even after COVID. It is more common after an infection with COVID, and we don't really know the cause, why some people's immune system will react to that level. So it is we cannot determine at face value who might develop that, but it is very, very rare. If you take the case of South Africa, there have been about 10 million doses of Johnson vaccine that have been administered. And we have had, unfortunately, this one case. So it would be 1 in 10 million, which is really very rare. But we should be assured that if anything goes wrong, this would be picked up. And it also, just like with any medicine, there is no medicine that is completely safe. There is no vaccine that is completely safe. So and that is why we always ask that if you take any medication for any disease, if you feel any symptoms, if you take a vaccine, if you feel, even if the injection site pain where the vaccine was injected, you need to alert your healthcare worker. But in case of South Africa, our authorities have taken this very seriously, and that is why there was a committee established, which is called the National Immunization Safety Expert Committee. And what this committee does is, when there are reports of any reaction after vaccination, it goes to this committee and they collect all the information and see whether it is related to the vaccination. And that is what happened in this particular case.
And according to Sahpra, GBS can actually be linked, or severe GBS events can also be linked to other vaccines and medicines. So it's not strictly the J&J shot.
No, it's not strictly a J&J shot, and it can happen after, it is often more common after a bacterial or a viral infection, including COVID. So it's not only the J&J shot, but what is important is we should know that vaccines save lives. Each year, even before COVID, and even during COVID, vaccines have been saving millions of lives from other infectious diseases. And many lives have been saved from COVID-19 vaccination. When we continue to monitor when there are side effects and investigate and collect information, people shouldn't be alarmed.
And Prof, are there Is there an easy way to distinguish, shall we say, in terms of which vaccine is more suitable to people who suffer a particular ailment in the country, or not just in the country, in fact, in the world? I mean, in South Africa, we're dealing mainly with Pfizer and J&J, but is there medical advice that would say, for example, if you suffer from a particular issue, what you should go for is J&J or Pfizer?
You know, with the vaccination in South Africa started in early 2001 with the J&J vaccine, using the Wiysonge project where it was administered to healthcare workers. And about that time, you will remember that there was a case of when there were cases of people who developed what they call thrombosis in the U.S., and it was stopped to investigate and see how serious this was and if these were linked to the vaccine. After that, if you, it is now proven that if you have maybe a thrombotic condition or bleeding disorder more generally, if one would say, it might not be advisable to take the J&J vaccine. So there are very rare contraindications to vaccination, and this might be one of the cases, and that is why it's always good to provide the information about your conditions to the healthcare worker when you are going for the vaccination. But such contraindications are very rare, and in the case of J&J, it would be like bleeding disorders, for example, that you shouldn't take the J&J. You could go for the Pfizer vaccine, for example.
Professor Wiysonge, good to have your time, sir. Thank you very much for being on Daytime Update today. I want to take you